Hello, sir.
Hello, ma'am.
How are you?
Good, ma'am.
What's the good name, sir?
Shrikant.
Where are you from?
I'm from Hyderabad.
Okay, so Mr. Srikanth, can you tell me your problem? What was before?
Okay, so I have been diagnosed AVN in
Mm-hmm.
left hip
Okay.
1 year back.
1 year back.
Yeah,
Since
that
1 year
is
you are suffering.
2021. Yeah.
Okay.
2021 August I have been diagnosed my disease.
Okay.
And after that I have been to a bone decompression therapy.
Core decompression
Yeah,
it
core
is.
decompression.
Okay, no
So,
problem.
After the surgery, it took 3 months for bed rest,
Mm-hmm.
and then I joined my job. Then I have continued my job for 4 months. And
Okay. What's your profession actually?
I am a cabin crew.
Okay. Mm-hmm.
In my field actually there is no matter of sitting
Mm-hmm.
or like a desk job.
Yes,
it is only
yes.
a walking,
Yes.
or standing.
Yes, I can understand. So,
Yes, I have been continuously working for 4 months.
okay.
Again the pain came back, started again.
Mm-hmm.
So I have searched a lot. Then I have got to know this.
Shivaya Hospital. Okay. Then you
I
came.
joined on 12th of this month, that is October.
Okay, 12th of October you came. And today is the discharge. Yes.
Today my discharge,
So,
I can find a lot of difference.
okay.
I can see my leg. Before I was not able to move this outboard,
Mm-hmm.
but now I can move this outboard and go without pain.
Okay, that's great. And in sitting and standing?
There is no problem. I can stand. Normally I can sit.
Okay. Can you look? So, after treatment, what you are thinking now?
Yeah, it's better
Mm-hmm.
and it is also reasonable. They are charging very reasonable.
Yes.
So many patients, I will review. There are many patients in Hyderabad.
Yes.
They are so much suffering.
Mm-hmm.
So I will just suggest them. to go to
Okay,
this
so
hospital.
I would like to ask one question. In treatment, we used any kind of medicines, any kind of injection or surgical procedure?
No medicines, no cuttings, no injections.
So within 7 to 8 days, you are feeling so
They
much
have been
difference.
only massage, exercise.
Yes.
And diet.
Okay, so from today onwards, you have to follow your diet and exercises. Okay, so you would like to say something to your Hyderabad patient? Any message for them?
There are many people suffering from AVN. in
Yes,
Hyderabad,
yes.
But
Even they don't know what is the problem with them.
yeah, exactly.
Like they are spending
thinking
their
that
lives.
Some spine pain or some leg pain,
Mhm.
joint pain, that's all. But they are not properly known that it is an AVN.
Yes.
And many doctors also don't know about that.
This disease.
Yeah, there is only one solution, that is hip replacement. They are telling me.
Yes, exactly.
So if we come here, it's 100% solution.
Yes, exactly. If they will follow 100%, then they will get 100% results.
Yeah.
Thank you so
Depend on
much.
us also.
Thank you so much, Shrikantji, for sharing your feedback to us. Thank you so much.